For this episode, we will be talking about Minoxidil and its relationship with hair transplant. If a patient is on Minoxidil, should he or she get hair transplant also? Kaya huwag na natin patagalin, let's start our discussion. Everyone, welcome to Hairtransplantph. I am Dr. Jean Marie Marquez, a board-certified dermatologist.
And I'm Dr. Teresa Marie Reyes-Cacas, also a board-certified dermatologist and a hair transplant specialist.
So here in this channel, we share facts about hair loss and its surgical and medical management.
So if you, a family member or a friend, is suffering from hair loss, or if you just have great interest in this topic, just click and like the subscribe button below.
Welcome back, Dr. Hello, I'm back. So we just finished our annual convention.
So marami na namang mga kaalaman sa skin, sa nails, and of course, kasama lagi sa topics doon sa convention is about hair.
Yes. For this episode, we will be talking about Minoxidil and its relationship with hair transplant. So, Dr. Cacas, I saw your last video. You left a lot of questions about Minoxidil. So, questions like,
kung wari naka-Minoxidil ka, does it predispose you to some risks prior to having a hair transplant procedure?
If a patient is on Minoxidil, should he or she get hair transplant also?
Kung halimbawa, nag-transplant ka naman na, tapos na, and then tumubo na, ang ganda ng results, kailangan mo pa bang mag-Minoxidil?
Kaya huwag na natin patagalin, let's start our discussion. So from the previous episodes, we already discussed the qualities and the characteristics of Minoxidil. So if you recall, we said that Minoxidil is a vasodilator. We also mentioned that when you use Minoxidil, it should be as a maintenance. So forever mo siyang gagamitin. It can thicken the hairs, the thinned out hairs, but it cannot stop the hair loss.
You know, in fact, Doc Jean, wala naman talagang medication for hair na one-time, big time, no? So, ibig sabihin, lahat talaga sila, kailangan mo silang gamitin as a maintenance.
Yeah.
So, you will enjoy a few years of thick hair, pero afterwards, magpo-progress na rin yung thinning niya.
Ito pa, so Minoxidil can only work on hair strands that are thick. Pag sobrang nipis na yung hair, actually, hindi na rin siya masistimulate ng Minoxidil.
Tama yun.
So knowing some of the shortcomings of Minoxidil, this is where hair transplant comes into place. We all know that Minoxidil is a vasodilator, di ba? So in patients who are on Minoxidil and then they are planning to do hair transplant, usually the doctors would stop the Minoxidil for several days, so that we can prevent the bleeding during the transplant procedure.
Pag discontinue nung Minoxidil prior to a hair transplant procedure varies actually among doctors. Knowing the half-life, meron na naman tayong bagong term, half-life. Kung kailan half nung gamot mawawala sa system mo. Ilang hours yon or ano yung time frame na yun. Bali yun yung half-life. So, ang topical Minoxidil, pag nilagay mo sa scalp, ang half-life niya dun sa skin is around 22 hours. So, almost one day. Kalahati ng Minoxidil nun, yung nawala.
So, ilang days
so,
dapat?
Knowing that, probably most doctors could ask their patients, siguro, mga 3 days pwede na. 3 to 5 days prior to the hair transplant procedure, pwede mo nang ipatigil yung Minoxidil ng patient.
Pero what if, Dr. Cacas, naka-oral Minoxidil?
Oral.
Yes, yung
Pag
patient.
oral naman, based on some studies, ang half-life ng oral Minoxidil sa body ay mga 4 hours lang.
Oh, so shorter.
Oo, 4 hours ang half-life ng drug, pero based on studies also, nakita nila na nare-retain pa rin siya sa ating katawan hanggang 24 hours. So, pwede na rin mga 3 to 5 days i-discontinue yung Minoxidil.
So almost the same sila.
Mm-mm.
Both
Pero
oral.
some doctors, actually hindi na rin nila pinapastop. also depends on your skill na rin. Or yung iba na pe-predict nila kung kaya ba to o hindi kaya. So, it's gonna be the physician's decision na rin, finally.
Another condition when hair transplant is an option is kapag dumating na yung patient na very fine hairs na talaga sila. Kapag ganon, we will offer hair transplant already. Tulad ng ganitong photo. So kasi, as we mentioned, na ang minoxidil, if it's a very fine hair or very thin hair, it will really not have an effect anymore. So kapag ganyan na ang situation, straightforward, hair transplant na yan.
So, hair transplant is also recommended for our patients na initially naka-minoxidil na sila and then nag-enjoy na sila dun sa growth ng minoxidil nila. Pero after a few years, nag-progress na rin uli yung hair thinning process, no? Dito sa clinic, we see our patients na happy sila initially, di na sila nagpapakita sa atin, nagme-maintain na lang sila. Then eventually, tansya ko mga nasa 5 years yan eh. Mga after 5 years, bumabalik sila kasi in spite of medications, napapansin nila, nag-thin out na uli yung hair nila. Oo. Kaya at that point, ready na silang magpa-hair transplant or nagpapadagdag sila for density.
So another scenario is that a patient came in and we did hair transplant. So ang ganda na ng tubo. So usually we recommend na mag-minoxidil pa rin siya after hair transplant procedure. Why? Because number one, so that the thinning hair surrounding the transplanted area is may tutubo pa with the minoxidil.
Diba?
Yes.
Volume din yun.
Correct. And another reason kung bakit pa namin pinapaminoxidil yung patient is to prevent hair loss from the surrounding area na hindi natangiman pa.
And then finally, of course, hair transplant din ang ating option for patients who are non-compliant, as we mentioned earlier. Kasi syempre, paano naman tutubo yun kung hindi ka nagpapahid every single day, di ba? So kung kilala mo sarili mo, hindi mo talaga kaya magpahid, pa-transplant ka na.
So basically, yan ang relationship ng both minoxidil and hair transplant. So they work hand in hand to have a fuller effect, to have a better result. So sabi nga nila, 2 is better than 1, and it also applies for hair care.
Tama. Pero meron pa akong tanong. Ano bang minoxidil ang pinaka-okay na gamitin? Pare-pareho lang ba yan? Marami ba tayong options sa market dito sa Philippines? Nakikita ko kasi na merong liquid, merong foam, meron ako nakitang nasa oil, or serum, capsule, merong ibang percent. So, alin ba talaga ang mas okay sa kanila?
So what is the best option? Yes, so that's a very good question. Pero, sasagutin namin yan for the next episode.
Yeah, so stay tuned. Kasi sabi naman namin sa inyo, we'll walk you through your hair loss journey. Okay, bye!
Bye!